ET HealthWorld's Health TV special episode, we have Mr. Naveen Kumar, Special Secretary, Medical and Health Department, Government of Andhra Pradesh, who is looking into the complete digitization of operations in government health facilities of the state. Thanks a lot, Mr. Naveen, for taking our time and joining with us. Yeah. So to begin with, I would like to ask the question with rising COVID cases. Again, we are seeing this pattern of rising COVID cases in pan India in many states. And what kind of precautions have been taken in Andhra Pradesh? Recently, even 3 legislators were COVID positive. That was in news everywhere. Any specific measures to keep them in control?
If you see this particular phase of what do you call phase or wave, whatever you think you might put it, it is not that significant database. If you ask me, I would use this word database for one reason. If you see the last wave, which grew very fast and hit the 30% positivity in 3 weeks time, less than 3 weeks time, and now this has been growing significantly. We have touched a peak of 10% of positivity. I think given this kind of scale, I think we will be able to provide logistics. When you look at management of COVID, we talk it in terms of logistic. One reason is we need doctors, we need beds, we need supplies. And I think this is something within our own strength to do it. Given the lessons from the wave 2 and wave 3, we have learned how to manage the logistics and the infrastructure and the people for effective management of COVID right now. So I don't think there's much of challenge as of now. Let's see, wait and watch.
Any specific measures taken on the new Omicron variant? I mean, there's nothing much information as of now, but there's also a threat of this subvariant BA 2.75 said to be gaining ground in India. There are few cases, not in AP, but there are cases in Maharashtra and few other states in Delhi. And like anything on that?
If you have also noticed that AP state government has established a genome sequencing lab at Vijayawada. This is one of the things which we did a post Delta wave. So we are also keeping a close watch on the variants by doing genome sequencing regular basis. So we are on the watch. We have also sequenced around 5 variants of BA. So we are also keeping a close watch on it.
So so the 2 years of pandemic is not 2 years, it's been extending now. We don't know, we are like adapting to it. So how the state has pushed the rapid digitization in the public healthcare setup, if we can touch upon it, and can you tell us the transformation by the state in the digital approach, and how are you going to take forward the same, like telemedicine? And I think you have created 16 hubs and other significant steps that has started within this 2 years, and how you're going to continue with it. If you can just elaborate on that, please.
Yeah, you asked a couple of things right now. So what I would start is what we have been doing under ABDM, Ayushman Bharat Digital Mission. You must have also seen the CEO ABDM wrote a letter, NHA wrote a letter to the state government saying, appreciating what we have done in the past 1 year or so. So state government has initiated under the leadership of the Honorable Chief Minister to push digital health. I think he also thinks that digital health is a core for the setting up or giving services to the public, right? So that's very important. So we have created around 3 crore IDs, ABA IDs, on the basis of which we would be able to track people for the future. I keep explaining this thing. It's not present. For the future, we will be able to track people, follow up with medical protocols, and then we will be able to do it. And we were also able to push a lot of health records into these IDs. We already captured around 25,000 records into the system, which is our NCT survey, which we do door to door. We are also able to fetch data from the 104 services, Arogya services. And this is one thing which we have seen is comprehensive digital health records would be available at any level, be it PHC, CHC, or you go to government teaching hospital. You'll be able to fetch these data. We have already tested these things and we have displayed how we can fetch data. So it's already working. We are able to do it. We are also trying to integrate real-time PACS integration with our system. So that the data is also in a usable form, so that which you can do a little more analysis for in case of the using AI and ML. Very soon, I think we are already the leaders in digital health in the country. So we'll also do more in that space. Second question you asked is telemedicine. We are able to connect people at the ground. We have a very strong Gramavada Sachivalayam system for every Gramavada secretariat. We have an A&M sitting there at our wellness center or YSR health clinics, as we call it. And these data is transported and they are able to communicate with their medical officer through a telemedicine system. They are able to connect to the DH or AH if need be. And they are also able to, using the same system, they will be able to connect to the teaching hospital. Yesterday, the Honorable Chief Minister made it very clear this should be a 24/7 system and they would be able to do to and forth. And it's not like one cosmetic piece we did, and we should be effectively using this telemedicine to bring more services into public. That's what we have been trying to do. So we are strengthening this one. Also, we are also strengthening the digital pathology labs. So using it's also part of our telemedicine program where we'll also use the slides and technology to, make analysis. So this would be very effective in cancer care also. That makes them very, very important in our cancer care. Yes.
That brings into a small question, like how is the internet connectivity, the last mile connectivity, usually when you go to the district level or, when you go to the PHC levels, like secondary healthcare, we would like to know the ground reality. So there is a lot of, improvement in the telemedicine. We don't have any standard guidelines as of now or something, but the last mile internet connectivity and how the rural healthcare people, the grassroots level people are taking this telemedicine. If you can just touch on that.
Yeah, what we are trying to do is, like rightly you asked, we have technology stuff and all. Do we have connectivity bandwidth to supply those technology or not? That's the question, right? So what we are looking right now is to provide. We are also allocated the AP State Viper Limited to go and look into that connectivity issues. So we go as secretariat as an unit. So we are trying to connect every secretariat into the system. We have already scaled up. Very few secretariats are left out of the system. We are also looking at offline solutions for it in case if their online solution are not available. You can also look at offline solutions. So we are also looking forward to work on technology which will provide, offline solutions, minimal solutions. So we are working with a lot of startups and IT companies to come up with such ideas. Yes.
So now again, the central government's initiative is on unified health interface. So it's an open network designed to enable interoperable digital, health service delivery, like again the teleconsultation. So how you're seeing it's going to benefit overall pan India, the digital, this digital connectivity, how it's going to help connecting the grassroots level people again, the PHCs, the district level people, how it's going to be the future in maybe when the UHI actually, starts or kicks off.
Yeah, see, if you look at the connectivity, I call it as a digital bridge, right? So when you talk about connectivity as a digital bridge, there are two things which the digital bridge would do. One is letting that person who did not have an access. When you talk about public health, accessibility is also a very, very crucial component. The person who did not have an access to the services which would be normally available at a urban center. So that would be provided through this digital bridge. And second would be to also for us to reach them. It's two-way, right? So it would help us to reach them, provide for services. So we call it is more inclusive than anything, right? So it's for whole of society approach. I would call it whole of society approach for bringing everybody, providing the same kind of scale and services to all. So this is going to take time, but this will happen very soon in the future. We are already seeing COVID has helped us to learn a lot of things using technology. So this is scalable, yes.
So going specific about the state, the AP is like focusing a lot on cancer care space, particularly in the advanced radiotherapy at the district level, which is like a new initiative by the state. So can you tell us the progress?
Okay, yeah. One is that if you see the global disease burden, right? So if you take the global disease burden in the last decade and for the 10 decades before, the disease pattern has also changed. So right now, 70% of your disease is constituted by NCD, which is diabetes, hypertension, cardiovascular, and the cancer-related diseases. These constitute 70% of your disease pattern. So the entire philosophy in the public health has also changed to NCD, what we call as non-communicable diseases. And I think it's the second largest disease when you compare it in terms of the disease patterns, right? So it is important that we need to create an infrastructure to cater to this. That's the first question you asked me. Why did we do so? Every state has to do it. It's not just AP. Under the leadership of the Honorable Chief Minister, we are able to, envision. In fact, we also have an advisor only for comprehensive cancer care. We call it comprehensive cancer care. I'll also explain it because we are going to take care of the preventive cancer care, the treatment part, the curative part, and also palliative care. So these three components become a very crucial component in our comprehensive cancer care. So it's no more cancer care, it's more of comprehensive cancer care. And treatment part, we have hospitals, we have 57 network hospital under Arogya. We also have government hospital which treats for our 11 teaching hospitals also go for curative part. But we also see there's also need for awareness and early detection. Once we do awareness and early detection, if you see the numbers in the cancer, comprehensive cancer care, out of 10, 7 are already in advanced, stages of their disease. So it means that very little can be done to them. So we are, working on this preventive cancer care, the primary prevention and also secondary prevention. So we work on two components of the prevention where the person is told how to, keep a healthy life to prevent. And in case if he or she is detected for a cancer, which we call common cancers, oral, breast or cervix, it constitutes 30 to 35% of your total cancer group, right? So we are able to treat them. And once we bring it down and we do an early detection, it's easy to give them treatment also. And the survival rate increase, cost of treatment goes down. So these are things which we are working on. We are also looking at, developing a comprehensive palliative care also. When I call about comprehensive palliative care, it's not just about treatment. A cancer patient goes through a treatment for 2-3 years, and he or she would need the comprehensive cancer care, the social, economic support, the psychological support, follow-up. So that's why we call it comprehensive palliative care also. So we're working on those lines. So the entire agenda we learned from other states. We also learned how to, put our strengths behind that. The plan, like we have a very strong Vijayawada system which we have in our state. So we are using those, networks to, strengthen the palliative care at the grassroots level. So we will be the first state to do so, to give a very comprehensive approach to cancer care.
Any data on this, Naveen, on the cancer care? Like you said, it's a comprehensive cancer care. Like, mostly, which are the cancers which are like more amongst the people?
Cervical cancer and breast cancer. It's if you see it's a pattern, right? It's not the same way across the state. In urban centers, you'll have more breast cancer and less cervical cancer. In rural center, it would be more or less the same. And if you see male cancers, it is mostly oral cancers, and there are regional aspects to it. So that's the reason we are also one of the states which have made cancer as a notifiable disease, and soon we'll launch a registry, the India's first digital registry for cancer, where all the data would be collected and some analysis would happen. When you ask me how many patients are there in AP, I would only tell you approximate number. Like we'll say, okay, maybe it is 53,000 or maybe 70,000. So somewhere in between the range. So our registry will tell us exactly how many cases are there and what are the patterns against it. So that's one of the research activities we are taking about under comprehensive cancer care.
So that's a good initiative actually. It's like replicated in other states as well. So moving on, the Andhra Pradesh CM had directed the health department to bring Arogya public healthcare scheme benefits under direct benefit transfer. So how is this move going to help the patients and to the hospitals as well? If you can just talk about that.
One of the best things which we have done, right? So for example, the patient has full information and also of knowledge of what treatment he underwent. So it means that yesterday only we have finalized there is a consent form he or she has to give, and also confirmation what is the kind of treatment which was performed on him or her. Okay, so this is something which unique, right? So it's what was happening before was the money was directly going into the hospital accounts. Now it would transmit through the patient's account, which means the patient is in full knowledge of what treatment he underwent or she underwent, and also the consent. So it also reduces that gaps which we see in the insurance sector, medical insurance sector, where the patient is not aware of what treatment happened. So this helps also. And we spend around 3,000 crores in medical insurance. We are the largest in the country. No other state spends so much money. And I think if you even look at per capita expenditure on medical insurance, we must be the largest. So this is the best thing which the state government has done so far. So that's a very, very good initiative.
So this tagline Arogya Andhra Pradesh is like, very much promoted by the state government, of AP. So can you tell us in what ways the state wants to achieve?
The Andhra Pradesh would help us to grow a very strong state, and also it also involves public participation in it. It's the tagline Arogya Andhra means that public also participate in strengthening the health systems in the country by giving feedback, by telling, we are passing information. This also creates awareness amongst public to, to access information on the network hospital, the kind of treatments they can avail, the kind of services they can avail from the government. So this is a two-way mechanism which is promoted in the state to help people to come together and understand and strengthen our systems.
Thanks for taking out time and helping our viewers understand about AP's initiatives in healthcare. Thanks a lot, Mr. Naveen, for joining us in the Health TV section.
Thank you so much.